take a moment and look closely at your fingernails. Not the polish, not whether they need trimming. Observe the surface, the shape, the ridges, the color near the base, and how the surrounding skin sits. Most adults have never truly examined their nails. They trim them, paint them, maybe bite them during stressful moments, yet rarely read the subtle signs nails can reveal. Your nails might be quietly signaling issues with your nervous system, kidneys, liver, and brain that have been developing for months or even years. After 60, the body's capacity to mask internal dysfunction begins to narrow. The resilience that kept systems stable in your 40s becomes thinner. It's not aging that is a problem, but the shrinking margin between silent struggle and overt crisis. In this window, nails often remain one of the few areas leaving visible traces. There are 4 nail appearances linked in research to serious conditions affecting adults over 60, concerning the brain, nervous system, kidneys, and systemic metabolism. These conditions are not rare and may not be discussed during routine medical visits simply because a 15-minute appointment cannot cover everything. The 4th sign is particularly common among patients with vague neurological complaints like fatigue, mild memory fog, or tingling in the hands, yet almost nobody connects it to their nails. Nails grow from the nail matrix, a band of dividing cells beneath the nail base. These cells interact constantly with the bloodstream, peripheral nerves, and metabolic environment. Nutrients, toxins, and inflammatory signals pass through the tissue that nourishes the matrix. Nails act like a geological record, encoding the body's internal state as they grow about 3 millimeters per month. A disruption in nutrition 3 months prior may appear as a ridge today, while a chronic metabolic issue may gradually alter nail shape or color over years. After 60, peripheral nerves feeding the hands and feet become more susceptible to nutritional deficiencies, vascular insufficiency, and systemic inflammation. Nail matrix health reflects these stresses before other symptoms arise. Doctors often overlook nails in routine exams unless changes are extreme. Subtle warning signs can go unnoticed for years. One key indicator is longitudinal ridging, often considered normal aging. Fine vertical lines running from base to tip may be benign when symmetrical across all nails. However, asymmetric ridging, worsening brittleness over 12 to 24 months, along with tremors, smaller handwriting, or weaker grip, is associated with early Parkinson's disease. Parkinson's begins with peripheral and autonomic nervous dysfunction, not initially with movement issues. Dopaminergic cell loss in the substantia is not the first event. During the prodromal phase, which can last up to a decade, changes in skin and nail health appear before noticeable tremors. Autonomic nerves regulating fingertip blood flow and sweat influence nail tissue. As these signals falter, nail quality changes. Vertical ridges alone do not indicate Parkinson's. It's the combination of asymmetric progression, handwriting changes, subtle gait shifts, altered arm swing, and reduced sense of smell that is revealing. One patient, 67 years old, came in because his wife noticed smaller handwriting over 18 months. His left thumbnail showed much deeper ridging than the right and broke more easily, which he had attributed to being right-handed. He also mentioned diminished taste and smell. The combination of these findings led to a detailed neurological evaluation, confirming early-stage Parkinson's disease. Because we identified it during the prodromal phase, treatment started at a stage where it could meaningfully preserve quality of life far longer than waiting for obvious clinical signs. The practical advice is simple. Examine your thumbnails carefully. Place both hands side by side in good natural light. If the ridging pattern differs noticeably between your left and right thumbnail, record the observation. Check if your handwriting size has changed. Note any alterations in your sense of smell. At your next medical visit, request a neurological evaluation. The second sign involves Bowes lines and kidney disease. Look for horizontal lines or grooves across the nails. These are not vertical, but run across the width, like a pressed groove in clay. Known as Bowes lines, after French physician Joseph-Honoré Simon-Bau, who described them in the 1840s, they appear when the nail matrix is disrupted and stops normal growth temporarily. When growth resumes, a groove marks the interruption. A single Bowes line on several nails often follows major illness, high fever, serious infection, or surgery. If you had COVID-19 in the last 2 years and notice a groove across multiple nails, this is likely the cause, often referred to as COVID nails. However, recurring Bowes lines at different heights, appearing without obvious illness, suggest something else. In adults over 60, they are associated with chronic kidney disease. Kidneys filter waste from blood, including nitrogenous byproducts that can become toxic. When kidney function declines, uremia develops, and the buildup of urea and nitrogen waste affects rapidly dividing cells, especially in the nail matrix, interrupting normal growth. Chronic kidney disease is common in adults over 60 and is often asymptomatic in early stages. Many people notice repeating grooves but dismiss them. Another nail sign tied to kidney disease is half-and-half nails, or Lindsay's nails. Here, the lower half appears white or pale, while the upper half near the tip is pink or brown, with a sharp dividing line. This pattern is strongly linked to chronic renal failure. Observing both Bowes lines and half coloring warrants a specific conversation with a doctor about kidney function. One patient, 71 years old, noticed grooves on her nails over 3 years. She assumed minor illnesses were responsible. Unknown to her, kidney function had been declining since her late 60s. When she visited for persistent leg cramps and morning brain fog, her nail findings prompted a full metabolic panel. Her eGFR, a measure of kidney filtration, was significantly below normal. Early-stage CKD was confirmed. Dietary changes and careful medication management stabilized her kidney function far better than if discovery had occurred 2 or 3 years later. Examine nails across the width, not just length. If horizontal grooves appear without a clear episodic illness, ask your doctor for kidney blood tests including creatinine and eGFR. Note any sharp color change between lower and upper nail halves when discussing renal function. The third sign is spoon nails and iron deficiency. Examine your nails from the side. Normal nails curve gently downward over the fingertip. Some, however, begin to curve upward at the edges, forming a concave center, like a small spoon. A drop of water would pool rather than roll off. Known as koilonychia, spoon nails in adults over 60 are significant. They are most commonly linked to iron deficiency. Iron deficiency in older adults does not only cause fatigue, but also neurological symptoms. Cognitive changes, memory difficulties, and other issues often mistaken for aging or early dementia may actually result from a correctable nutritional deficiency. Iron is essential not only for red blood cells, but also for myelin synthesis, coating nerve fibers to support rapid electrical signaling. It contributes to neurotransmitter production, including dopamine and serotonin, and supports frontal lobe function, responsible for memory retrieval, processing speed, and executive function. Iron stores can decline silently in older adults due to reduced dietary intake, medication interference, or minor gastrointestinal bleeding. The brain suffers early, and nails made of rapidly dividing cells sensitive to iron show structural changes before neurological symptoms are obvious. Typical neurological signs of iron deficiency in older adults include fatigue, disproportionate to activity, difficulty concentrating, mental slowing, and restless legs at night. If your nails have gradually become concave, with lifted edges and hollow centers, along with any of these neurological symptoms, iron deficiency anemia should be evaluated with a blood test before attributing issues to more serious causes. Treating iron deficiency anemia in an older adult experiencing cognitive issues can often produce meaningful, measurable improvement in brain function. Many changes are not permanent. They are reversible consequences of a correctable deficiency, but they will remain unaddressed if no one recognizes the nail signs that could trigger investigation. The fourth sign, the disappearing lunula, is critical for assessing nervous system health. Look at the base of your thumbs, just above the cuticle where new nail begins. Do you see a pale crescent-shaped arc like a small half-moon? This is the lunula, the visible part of the nail matrix where new nail is actively produced. In healthy adults, the lunula should be clearly visible on both thumbs, usually visible on index fingers, sometimes on middle fingers, less reliably on ring fingers, and rarely on pinkies, which is normal. Observe carefully. Has your lunula shrunk beneath the cuticle or become faint? This gradual disappearance, known as absent lunula or nail matrix atrophy, has been documented in medical literature in connection with serious systemic conditions. The concern for neurologists is its association with vitamin B12 deficiency and subacute combined degeneration of the spinal cord. Vitamin B12 is essential for myelin production, the protective coating of nerves. Without sufficient B12, myelin covering the spinal cord and peripheral nerves degrades. This process can cause numbness and tingling in hands and feet, balance and coordination difficulties, muscle weakness, cognitive changes including memory loss, and in advanced cases, irreversible spinal cord damage. In adults over 60, B12 deficiency often develops slowly and silently, mostly for metabolic rather than dietary reasons. After 60, the stomach produces less intrinsic factor, a protein crucial for absorbing B12. Common medications, including metformin for diabetes and proton pump inhibitors for acid reflux, further reduce absorption. Many older adults are B12 deficient without realizing it, as routine blood panels often do not test for it. The nail matrix, being highly metabolically active, shows consequences of deficiency years before neurological symptoms become obvious. A patient, 73-year-old Evelyn, visited after her family noticed memory lapses. She occasionally felt unsteady, and her hands tingled at night. Neurological examination revealed reduced vibration sense in her lower limbs, an early sign of subacute combined degeneration. Both her lunulae had completely disappeared. Her B12 level was critically low, partly due to long-term proton pump inhibitor use and minimal dietary intake. High-dose B12 supplementation, initially via injections due to poor absorption, led to substantial improvement over months. Her balance largely normalized, memory fog lifted, and her lunulae began to reappear at the base of both thumbs within 3 months. This recovery was possible because the problem was identified early, by noticing the lunula. Take practical steps today. Examine your nails in natural daylight. Hold both hands side by side. Compare texture, quality, and appearance. Note differences between hands, paired with any changes in smell, handwriting, or sleep. Look for horizontal grooves, concave nails, and the lunula at the base of thumbs and index fingers. Photograph both hands, ensuring even light and clear visibility of the nail base. Date and save the image. If you notice any of the 4 signs today, record which sign, which finger, and duration. Note accompanying symptoms, such as numbness, tingling, fatigue, memory issues, leg cramps, or balance problems. If you observe 2 or more signs or 1 sign with neurological symptoms, do not wait for your annual checkup. Call your doctor this week. Request a B12 level, complete blood count with iron studies, basic metabolic panel for kidney function, and a neurological evaluation if symptoms involve hands, feet, balance, or cognition. Remember, nail signs are not diagnoses. They require context, medical history, medications, other symptoms, and professional examination. They serve as prompts for conversations that might not have happened otherwise. Early Parkinson's, chronic kidney disease, iron deficiency, impacting cognition, and B12-related spinal and brain dysfunction all share one key trait. They are far more treatable when detected early. Early recognition is often possible if you know what to look for. Your body has communicated for decades through symptoms and visible signs on skin and nails, often overlooked. The nails you glanced at this morning may be the most accurate diagnostic window your body offers this year. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.